Gastroesophageal Reflux Disease, or GERD, is a common digestive disorder that affects millions of people worldwide. It occurs when the lower esophageal sphincter, a muscular ring at the junction of the esophagus and stomach, fails to function properly. This dysfunction allows stomach contents, including acid, to flow back into the esophagus, leading to symptoms such as heartburn, regurgitation, and chest discomfort. With the rise in obesity rates, GERD has become increasingly prevalent, impacting quality of life and sometimes leading to serious complications if left untreated. The primary cause of GERD is the weakening or relaxation of the lower esophageal sphincter. This can be influenced by several factors, including obesity, pregnancy, certain foods, medications, and even genetic predisposition. When this sphincter does not close tightly, stomach acid and digestive juices can escape into the esophagus, causing irritation and inflammation. Understanding these underlying causes is crucial for both prevention and effective management of GERD symptoms. GERD presents with a variety of symptoms, the most common being heartburn, a burning sensation in the chest. Other symptoms include regurgitation of food or sour liquid, difficulty swallowing, chronic cough, and even chest pain. For some, these symptoms are occasional, but for others, they can be persistent and severe, significantly affecting daily activities and sleep quality. Recognizing these symptoms early can help guide timely intervention and prevent complications. When GERD is first diagnosed, doctors typically recommend lifestyle changes and medications as the initial treatment approach. Lifestyle modifications may include weight loss, dietary adjustments, avoiding trigger foods, and elevating the head of the bed. Medications such as antacids, H2 blockers, and proton pump inhibitors are commonly prescribed to reduce stomach acid and relieve symptoms. These non-surgical methods are effective for many patients, but not all achieve lasting relief. Surgical intervention is considered for GERD patients who continue to experience symptoms despite optimal medical therapy, develop complications, or prefer not to rely on lifelong medication. Surgery is also recommended for those with severe esophagitis or other related conditions. The goal of surgery is to restore the function of the lower esophageal sphincter and prevent reflux, offering a long-term solution for symptom control. Minimally invasive laparoscopic surgery has revolutionized the treatment of GERD. This approach uses small incisions, specialized instruments, and a camera to perform the surgery with less pain, faster recovery, and fewer complications compared to traditional open surgery. Laparoscopic techniques have become the standard of care for anti-reflux procedures, making surgery safer and more accessible for patients. There are several surgical techniques available for anti-reflux treatment, each with its own advantages and considerations. The most common procedures include Nissen fundoplication, Toupette fundoplication, and door fundoplication. All these surgeries aim to strengthen the lower esophageal sphincter, but they differ in the way the stomach is wrapped around the esophagus and the extent of the wrap. Nissen fundoplication is the most widely performed anti-reflux surgery worldwide. In this procedure, the upper part of the stomach is wrapped 360 degrees around the lower esophagus. This full wrap reinforces the sphincter, effectively preventing acid reflux. While it provides excellent reflux control, some patients may experience difficulty swallowing or gas bloat syndrome after surgery. Toupette fundoplication involves a partial 270-degree wrap of the stomach around the back of the esophagus. This posterior partial wrap is designed to provide effective reflux control while reducing the risk of post-operative swallowing difficulties and gas-related symptoms. It is often chosen for patients who are at higher risk for dysphagia or who have weak esophageal motility. Door fundoplication is an anterior partial wrap where the stomach is wrapped 180 to 200 degrees around the front of the esophagus. This technique is less likely to cause swallowing problems and is sometimes used in patients with specific anatomical considerations or those undergoing other esophageal procedures. However, there is a slightly higher chance of reflux recurrence, and some patients may eventually need reoperation. Each anti-reflux surgical technique offers unique benefits and potential drawbacks. Nissen fundoplication is known for its strong reflux control, but may lead to more swallowing and gas-related issues. Toupet fundoplication provides similar reflux relief with fewer side effects, while Door fundoplication is gentler on swallowing, but may not be as durable in the long term. Choosing the right procedure depends on individual patient factors and surgeon expertise. The main advantage of Nissen fundoplication is its ability to provide robust and lasting reflux control. However, the complete 360-degree wrap can sometimes be too tight, leading to postoperative dysphagia, difficulty swallowing, and gas bloat syndrome, where patients are unable to belch or vomit easily. These side effects are important considerations when selecting this procedure. Toupet fundoplication offers a balance between effective reflux control and a lower risk of postoperative complications. The partial wrap allows for easier swallowing and less gas retention, making it a preferred option for patients with weak esophageal function. However, because the wrap is not complete, there is a theoretical risk that reflux control may not be as durable over time. Door fundoplication is associated with a lower risk of swallowing difficulties, making it suitable for patients who are particularly concerned about this side effect. However, the partial anterior wrap may not provide as strong or lasting reflux control as the other techniques. Some patients may experience recurrence of symptoms and require additional surgery in the future. Anti-reflux surgery works by reinforcing the lower esophageal sphincter, preventing stomach acid from flowing back into the esophagus. This not only relieves symptoms but also helps prevent long-term complications such as esophagitis, strictures, and Barrett's esophagus. For many patients, surgery offers a chance to reduce or eliminate the need for daily medications and improve overall quality of life. Recent advances in diagnostic methods have greatly improved the management of GERD. High-resolution manometry, pH monitoring, and endoscopic techniques allow doctors to accurately assess esophageal function and tailor treatment plans. These innovations help identify the best candidates for surgery and ensure optimal outcomes. Minimally invasive surgical techniques, particularly laparoscopy, have transformed anti-reflux surgery. These procedures use small incisions and advanced instruments, resulting in less pain, shorter hospital stays, and quicker return to normal activities. Patients benefit from reduced scarring and lower risk of infection, making these techniques the preferred choice for most surgeons. Most patients who undergo laparoscopic anti-reflux surgery experience significant improvement in GERD symptoms. They often report better quality of life, reduced dependence on medications, and fewer complications related to acid reflux. While some side effects can occur, the overall satisfaction rate with these procedures is high, especially when patients are carefully selected and well informed. Selecting the most appropriate anti-reflux surgery depends on several factors, including the patient's anatomy, esophageal function, symptom severity, and personal preferences. Surgeons consider these aspects, along with the risks and benefits of each procedure, to recommend the best option for each individual. Open communication between patient and surgeon is key to achieving the best possible outcome. Among the various anti-reflux procedures, laparoscopic Nissen fundoplication remains the most commonly performed surgery worldwide. Its strong track record for reflux control and long-term results make it the preferred choice for many surgeons and patients. However, the availability of alternative techniques ensures that treatment can be tailored to individual needs. In summary, GERD is a widespread condition that can significantly impact daily life. While lifestyle changes and medications are effective for many, surgery offers a durable solution for those with persistent symptoms. Advances in minimally invasive techniques and diagnostics have improved outcomes and patient satisfaction. Understanding the differences between Nissen, Toupet, and Dor fundoplication helps patients and doctors make informed decisions for optimal care.